Good afternoon, and welcome to today's webinar entitled Exploring High Demand Healthcare Roles and Next Steps in Your Education. This is the first in a three-part series, and will cover examples of high demand roles in hospitals that you can have with completion of a credential or short-term training program. My name is Sharon Alexander, and I'm the Director of Workforce Initiatives here at the Virginia Hospital and Healthcare Association. This webinar is hosted in partnership with the Virginia Community College System, and I'm joined by my colleague, Philmika Reed, Director of Healthcare Workforce and Community Engagement, who you will hear from a little later on in the program. Real quick, a rundown of today's event. We have a few speakers from Augusta Health who will talk about a couple of high demand hospital roles and their workforce training programs. We'll then transition to the VCCS team to hear about the various healthcare pathways through Virginia's community colleges. And lastly, we will direct you to a great resource with more information on healthcare careers and hospital jobs. Without further ado, I will turn it over to our first speaker for today, Kira Griffin, Director of Emergency Services at Augusta Health. Kira?
Thank you. Happy Wednesday, everyone. Thank you for joining the call today. So as the Director of Emergency Services at Augusta Health, today I'm just going to talk to you all a little bit about a career available in the healthcare setting as far as being an emergency medical technician. So as many of you are aware, that EMT is an available field within our community with running pre-hospital, either as volunteer or working with a private industry in transportation. But a lot of hospital settings also use the EMT role setting as similar to a patient care technician within the hospital. And ERs are an area that utilize that role the most. So I was going to talk to you all today a little bit about what that role could look like for you all. So in an emergency department, the emergency department tech works directly under the supervision of a registered nurse or in conjunction with one of our medical providers. The medical provider could be a doctor, or it could be a mid-level, being a PA, a physician assistant, or a nurse practitioner. And what some of the, thank you. And what some of those job duties could look like that our EMTs would perform would be obtainment of a 12-lead EKG, getting vital signs for our patients, also including point of care testing. That could be a blood glucose. A lot of hospitals utilize a system called an iStat, which is a just-in-time blood level without sending a specimen to the lab, so that we can get patients quickly for assessment for a CT exam, or get a quick assessment of what their heart enzyme looks like in case we would want to get them to move them to another area of the hospital, like the cath lab, for example, more quickly without waiting for a full spin down on an analyzer in the lab. So our emergency technicians can help facilitate that for us. They do a lot of lab collection for us, specimen collection, and they do a lot of IV insertion. In the healthcare setting, in our hospital specific, we do advanced training and allow our EMTs to get trained to place actually ultrasound IVs. So for our patients that are a harder IV stick, we can do more training with the EMT role to train you to utilize a bedside ultrasound machine to allow you to have more advanced skill set in placing an IV on a more difficult stick patient. In our facility, our EMTs do that within the emergency department, and they also float to our inpatient unit to help with those as well when needed. Our EMTs are highly engaged with our critical care patients. They actually are the right hand to our providers. So they assist in all of our STEMI alerts, our stroke alerts, our trauma alerts, and they are the code blue response for our hospital. Other facilities could manage that differently, but at our facility specific, our doctors respond to our code blues to do airway, and the EMTs are crucial in helping with airway assistance, making sure we have the right ET tube, helping with cricoid pressure if needed, getting the gyroscope ready, that all the materials are ready. They also assist with a lot of procedures, a lot of sterile procedures, so chest tube placement, a central line placement, and again, our culvert intubation. So they do a lot of items that are low volume but high criticality. And so again, just their they are a true asset to the emergency department, to the nurse and the provider. And specific to our area or our department, we can train EMTs to do a further skill set as far as wound care, splinting and casting, and restraint application for our patients that may need that. No day looks the same in an emergency department. I think that's why most people gravitate to an emergency department. Our days change, our functions and our roles change. The EMT role is what you learn in the training within the programs. Is more geared to the pre-hospital world, but again, it's a great foundation that we can then build upon and train you upon within the acute care setting within the hospital. And what we see a lot in this role is the team member then becomes exposed to these patients and those job duties, and we see them a lot of times advance in their careers and continue back to school to either get their registered nurse and come work and continue to work as a bedside nurse, or we will also see these team members go back to school. These are great. This is a great experience for an application if you would be interested in becoming a physician assistant. We do have a lot of EMTs that continue on to school to be physician assistants. Our facility specific, but I know a lot of healthcare facilities will also, while you're working within this role, there's lots of opportunity for tuition reimbursement to continue to invest in you as a team member to grow your career.
Wonderful. Thank you, Kira. And next we'll turn it over to Lindsay Scott, Director of Throughput and Staffing, who's going to talk to us about another role, nurse aides, and opportunities for you in the hospital. Lindsay?
Hi there. So I'm Lindsay. I'm our Director of Throughput and Staffing. So I oversee a lot of our student programs as I oversee our clinical resource team. So one of the things that I've done a lot of work with in my time in this role is we have transitioned to doing work-based learning and nurse aid programs here within the organization. And so one of the ways that we do that is through a partnership with our local college, our local community college and tech school. And we offer some work-based learning programs in conjunction with education. So what this means is we are allowing them to go to school. Sometimes they're in high school, so they're going to these programs, but then they come to me and my teams for their education and their hands-on portions. And so what they get out of this when they're done is they are getting their CNA license, which is licensed through the Board of Nursing. Another way that we're doing that as well is we do partner with them to teach our own course. Also licensed, but we also do an unlicensed PCT program here in the hospital where you can come in and we can teach you everything you need to know. It does not license through the Board of Nursing, but it's still a great stepping stone in very similar roles. Similar to what Kira was just talking about with her EMTs, our CNAs and our nurse aides are really the right hand of the nurse. They are there helping manage Foley care, ins and outs. They are helping document, they are taking vital signs, they are doing lots of things to help with those nursing care pieces that the floor nurses need lots of help with. So they are doing AccuChecks. They are phlebotomy trained. A lot of them are. So they are drawing blood. They are doing those AccuChecks. They are helping document vital signs. They do assist in CPR when a code blue is called until the emergency department team does show up. And so they are very critical to have. They are a huge piece of what makes that that part of the hospital turn. So their typical day is, they're there, they're helping feed, they're helping prepare meals, they're helping get people up, they're helping with discharging as well as admissions. We do sometimes utilize them in our intensive care unit, and what they are is the right hand to help turn and provide assistance to some of those sicker patients as a second set of hands. If you can flip slides, I'm going to talk a little bit about our work-based learning stuff that we've been doing. So one of the things that we've done, so in our area, we're a pretty rural hospital. We are the only hospital within our county here. And so we have limited patient care tech resources, which is that nurse aid position. So those partnerships with the school help us to really provide experience to those technicians. Now they're similar to the EMT, there are multiple roles that you can work in multiple areas. They do use nurse aides sometimes, and they use them in long-term care, assisted living facilities, rehab facilities, and here within the hospital. But what we've done with these work-based learning pieces and just these entry-level nurse aid positions is it really gives you a hands-on experience And unlike an externship that maybe happens just through school, these are paid positions typically. So we've really had a good time expanding these for these students. While they're here, since it is a paid position, it is a staff position, they actually do qualify for all of our financial aid and tuition reimbursement. And similar to the EMT, while we nurture and kind of help get you your feet wet and in the hospital setting, there is the opportunity to go back to school to become an RN or an LPN, and we do have programs also set up for those to help pay for those, as well as get you that experience and a little extra while you're getting through school, as well as providing you a position. So it's a great stepping stone. I know a lot of our nursing leadership team started in this area, myself as well, and so it was a lot of learning. And it's just a great role for you to look at if you're thinking healthcare is. It's not a huge time commitment to get this. It's usually about a month, and like I said, a lot of places we can do it through work-based learning or an in-house program, and so it does really help you kind of to decide, is this the right area of healthcare for me? So you can kind of try it on and get some experience while you're trying to figure out what your next steps are. Yeah.
Wonderful. Thank you.
Yeah,
I'm going to
absolutely.
turn it over. We're lucky to have Sherry Carter, Director of Talent Acquisition, on as well to share some summary remarks, maybe words of wisdom and next steps. Sherry?
Hey, good afternoon. Thanks you for having Augusta Health on the call today. So, yeah, and you've probably heard a lot in the news or as you're exploring your healthcare career about some of the challenges that we've encountered over the past few years, perhaps nursing shortages, just the toll of COVID and some of the roles that we have been really looking for. We've in talent acquisition, or those people that do the hiring and recruiting, we've discovered we can't hire our way out of some of these shortages. So the best bet is to reach back into the schools and really kind of grow the students into these healthcare roles. And so while you may hear about those challenges, what I have discovered in the 9 years that I've been in healthcare is that this is probably like the best time to get in for the support that you may need to help get you through these careers, whether it's career growth and development internal to the hospital or the health systems, or through educational partnerships that Lindsay and Kira were talking about. And then also what Dr. Lawson will be talking about afterwards about the tuition that's available, the assistance that's available out there, and how to help fund your growth into the healthcare field. So here at Augusta Health, as Lindsay and Kira were just discussing, we have formed a lot of partnerships with schools, down to the point where, when you're thinking about a career, you should be creating a plan with your career counselor, your career resource counselors, any of those network people that you have in your network that you know over in healthcare, to look for opportunities for things like shadowing, mentorship programs, internship programs, teen volunteer programs, kind of just let you explore what those opportunities are. There's opportunities in with your school system to do, as what they were discussing earlier, work-based learning. We have just started with some PCTs that Lindsay was talking about. She's been helping us manage that this year, that are work-based learning with our local vocational school. We've also brought in some CCMAs from the vocational school that's been in our practices. They're doing rotations, just to help them launch those careers, to really discover what those next steps are going to look like for them. So take a look at some of those opportunities. Also apprenticeships. A lot of health systems, as we were saying earlier, have some internal apprenticeship programs. They may not lead to the certification or the licensure, but it is that stepping stone to, again, help you explore which direction you want to go to. Because you could come in as a PCT or a nurse aide or an EMT and work through whatever ladder may be available to you internally. Then the next thing you know, you're getting your ADN through an Earn While You Learn program at the local community college and becoming a registered nurse, or you're going back to the vocational school to become an LPN. There's so many different opportunities when you look at it from the career laddering or the career progression. A lot of health systems have really put this in place to just take you all the way up through that ladder. So look into what those career tracks. Later they'll be talking about a lot of those resources out there that you could look at that really just shows you what that progression can look like. And again, internally here, we also do team member development. So you'll find that a lot of health systems and a lot of hospitals will have developmental opportunities as well. So it's not just those hard skills and those competencies, but it'll also be things that you will need for your own professional growth. Maybe it's going to be some IT skills or communication skills, leadership skills as you want to move into more management, frontline leader, director roles. So there's always going to be those wraparound services, those wraparound supports that you could have once you're in a hospital or in the healthcare system. So that's just a brief way, brief introduction again of what's available out there for those resources and how you can create a plan when you start exploring and what the possibilities are for you as you progress through your healthcare career.
Thank you. Thank you, Sherry. So great. For the second portion of the event, we will hear about resources and educational opportunities for, just like Sherry mentioned, pursuing one of these high-demand healthcare roles. I will now turn it over to Philmika and Dr. Angela Lawhorn to share more about what is available.
Thank you, Sharon. Good afternoon, everyone. My name is Philmika Reed, and I am the Director for Healthcare Workforce and Community Engagement with Virginia Community College System. With my role, I have the opportunity to work with all 23 community colleges and their healthcare programs, along also working closely with healthcare organizations and hospitals across the state of Virginia. So why Virginia Community Colleges? Virginia Community College System consists of 23 community colleges across the state of Virginia. In referencing the map as shared on your screen, as you can see, we have community colleges within each community. And within those 23 community colleges, many of our community colleges have satellite programs that individuals can easily access and allows them the opportunity to enroll in classes and to take classes conveniently anywhere within the community college system campus. Within our community colleges, we offer very flexible course offerings, which includes online courses, hybrid, which individuals have the opportunity to come on campus to complete coursework and also complete their coursework online, as well as we also offer in-person classes where individuals can come on campus and complete all of their coursework online and on campus. Additionally, it is extremely reasonable cost. Virginia Community College System for individuals that are Virginia residents, in-state tuition is $163.40 per credit hour. We offer degree and non-degree options. Within our degree programs, we have a wide variety of options of 2-year associate degrees, career study certificates, and certificates. Our non-degree options also are available to include our fast forward programs. With our fast forward programs, those are workforce credential programs that can be easily completed within 8 weeks to 20 weeks. And my colleague, Dr. Lawhorn, will share more about that. We offer a wide variety of healthcare program offerings to include but not limited to registered nursing, licensed practical nursing, diagnostic medical sonography, surgical technology, phlebotomy, medical assistant, EMT, paramedic, nurse aide, and many, many more. To learn more about our healthcare programs, as well as learn more about the healthcare occupations, please reference this PowerPoint slide and the QR codes. Feel free to scan the QR codes. The QR codes will take you directly to our healthcare VCCS healthcare booklets, as well as our fast forward program information sheets. Within the healthcare booklets, you'll have the opportunity to learn not only about VCCS healthcare programs, but also healthcare occupations, salaries, Virginia Community College System finders, as well as more information about our G3 funding and our fast forward funding. Now I'll pass it along to my colleague, Dr. Angela Lawhorn.
Hey, good afternoon. So I am the Director of Career Education Programs and Workforce Partnerships. And basically, those are the CTE programs where you're learning a very specific trade or skill. And then workforce partnerships, and I'm so glad this was brought up. Work-based learning is key to students learning what's going to happen on the job and in real life. So majority of all of our healthcare programs have work-based learning and clinicals built in, and those happen because of the partnerships we have with employers. So, as Fomika was saying, we do have fast forward programs, and those are industry recognized credentials. So, when we talk about credentials, those could be licensed, like licensed practical nurse, or certifications like certified nurse aide. So, basically, you're sitting down for an exam or an assessment that comes from a third party, and once you pass that test or assessment, that's when you earn your credential, your license or certification. And as Fomika said, it can be completed in a matter of weeks and not years. So a lot of students will come through and do what we call stackable credentials. They'll start with a couple credentials and then add on to those. And the real important part is it's not just in our fast forward programs. A lot of our students are stacking their credentials into our credit academic programs and getting credits towards degrees. Next slide. So I really wanted to share here, Northern Virginia Community College has an excellent example of how students can start stacking credentials on the fast forward side of the house. So in their program, you can see here students can earn 6 credentials in 3 years, which is huge because that also includes becoming a registered nurse once you pass that final exam. So how it works, the student will start with CNA. So as soon as you become the certified nurse aide, you now have completed your prerequisites to begin the fast forward practical nursing program. After that, you start completing your stackable credentials, so registered medication aide, certified phlebotomy technician, the certified clinical medical assistant, and then you move into the licensed practical nurse program. Now, some students will go through, and if it's too challenging, they'll stop there. And the really good thing about stackable credentials is they're still leaving the program with credentials in hand that make them employable. But if they want to keep going, this is where they'll go through and then they can sit for that LPN test. Now, the key here is that if they want to continue going on the academic side, you'll see where it says ASN to RN. So that's our Associates in Nursing program. If you complete the stackable pathway, the college will give you 16 credits towards the registered nurse program. So that's 16 credits you don't have to repeat and take courses for. And then when you finish, you can sit for that RN exam. All right, next slide. So Fomika already talked about some of the programs in healthcare, but this just kind of gives you a wide array of what the different 23 colleges are doing across the state. So maybe you want to specialize in something. Dental hygiene is growing, veterinary science is growing, and then of course there's a lot of the office-focused jobs out there. So your medical coding and your health information management. So as you go through, there are other pathways that you can stack towards associate's degrees in the colleges. So this is probably the most important question. So we've got all these programs that will lead you up for all these great jobs and stackable credentials, but how are you going to pay for them? So the amazing thing is that the state of Virginia is helping fund these programs. So for fast forward programs, you can start as early as being a senior in high school. So we have something called our Workforce Credentials Grant. And when it says eligible Virginians, it just means you need to have resided in Virginia for at least a year with the intent to stay and work here. And what they'll do is they're going to look and see what they can cover for your stackable programs. And there's no limit to how many programs, how many credentials you can earn. So both Fast Forward and G3, as you go through, you can earn stackable credentials and then keep earning as many as you want to keep moving ahead. Now with G3, that's our newest funding, to get a skill, get a job, get ahead. That will pay for certain fast forward programs, but then also those credit programs on the academic side of the house. So if you want to start with stackable fast forward credentials, you can do that and then continue to Surge Tech or in the registered nurse program or what have you. And G3 will specifically fund healthcare programs. So it's last dollar. So the intent is when you come in and you apply for financial aid, whatever is not covered, we can try to cover everything else with G3. All right, and then the last slide. So where to go to get more information? So Filmika had these QR codes up, but here is the websites as well. So fastforwardva.org. The really important thing is you can put in your zip code. It will tell you which community college is closest to you and then what programs they offer. In some cases, if they don't have that program you're looking for, you can look at your next nearest community college or find out what's available online. We also have virginiag3.com, and then you can find where your local community college is by going to vccs.edu. Thank you.
Thank you, Filmika and Angela. It's great to hear about these programs and what is available. As a side note, in 2 weeks, we'll come back together for part 2 on this topic to talk about healthcare degree programs and examples of roles that you can have besides the traditional nurse or doctor that you may think of in a hospital. Very quickly, as promised, I'm going to share a resource for you to continue your studies and begin to think about applying for jobs. OnboardVirginia.com is your one-stop shop for information on every hospital, employer in Virginia, the distinct regions of Virginia and their unique offerings, salary and education requirements for top healthcare jobs. We have information on colleges and universities offering healthcare programs and what incentives exist for pursuing healthcare degrees. And we even have a job site on there where you can browse and apply to any open hospital job across Virginia. We probably take it for granted, but Virginia has something for everyone. We have the beaches, big cities with the DMV metro area. We have mountains, small towns with big character. And the cool thing about hospitals is that they're located all over in all of those settings. So you can find a great job opportunity in an area that you love. This is a screenshot of the homepage of the site. Again, onboardvirginia.com. You can see front and center the button that says Find Jobs and explore the other items on the page. This is an example of a result from the job search for CNA positions. You can see that there are 213 jobs currently available for CNAs and where those jobs are concentrated. You can also filter on the left if you have other criteria in your job search. And this is an example from filtering by employer. You can see here Augusta Health, and they have several CNA positions posted. Lastly, we have some resources for high school students specifically. If you go to our career paths page, here you can learn more about healthcare careers and entryways into a rewarding career in healthcare. So with that, I will turn it back to Filmika for any closing remarks.
Thank you, Sharon. Thank you again for everyone taking time out of your busy day to join us. If you have any questions, we have shared our contact information on the screen. Please feel free to reach out to us. To learn more about G3 funding and Fast Forward funding, please reference the websites that we have linked, as well as referencing Onboard Virginia. It's a phenomenal website which provides a ton of information about current healthcare jobs that are available, and it provides you all of the hospital job openings from across the state. Also, I just want to reference again the QR codes that were shared with you earlier. Those are great resources as well to gather and have a better understanding of these healthcare roles that are needed, and to understand what those job descriptions consist of. Again, thank you for attending. Any other questions, anything you would like to add, Sharon or Dr. Lawhorn?
Nope, I just want to say thank you for your participation today, and we hope that you'll join us for the future events. Thank you.
Thank you.